According to the supplemental poverty measure conducted by the U.S. Census Bureau in 2015, just over 10% of the population of Maryland suffers from poverty. That's roughly 599,000 people. Nationwide, the number jumps to 14.5%, or 45,725,000 people. In order for the supplemental poverty measure to calculate just how many people live in poverty, they calculate in factors such as money being received, like Social Security benefits, and money being taken away, like the cost of the out-of-pocket maximum being paid for health care. If the health care cost, defined as insurance premiums, co-pays, co-insurance, prescription drug costs, and other uncovered medical expenses, were not being considered, the number of impoverished people in the United States would drop by 11.2 million. When it comes to health care, people living in poverty have the lowest health care coverage rate, at 82.6% of people being uninsured.
Hello.
Hello.
Can you state your name?
Kennedy Whitefoot.
What socioeconomic status would you say you are?
Middle class.
Do you have health care?
Yes.
Would you say health care is worth the cost?
Yes.
Yes. How many times would you say you visit the doctor or etc. to use your health care package?
Once a year.
Would you advise others getting a health care package?
Yes.
I think health disparities are a very downstream effect of us being in the United States. We live in a country that has generational poverty. We live in a country that has structural racism. We live in a country that, is slowly trying to change things. The problem is so upstream that this gap isn't going to close until we fix ourselves as a nation.
On average, how many of your patients have health care of some sort?
90% of the patients they come to our office have insurance, and 50% of them is private insurance, and the rest have state insurance.
For those who do have it, how many are middle class or higher?
I would say 50% are middle class or higher, and the rest is the rest is use state insurance also has state insurance.
What is state insurance?
State insurance is Medicaid. Through Medicaid, after they get Medicaid, they have MCOs, and they get them insurance. So the state help them to have insurance. So they don't pay for the insurance, but they have an insurance for their kids. And so because our office is a pediatrician office, so kids comes from 0 to age 23, and the parents get or the state give help them to have insurance for their kids, and that's why they have Medicaid. Medicaid is a state insurance that gives to people they can't afford to pay for insurance, and they are eligible for Medicaid, because some they are not eligible to get Medicaid, and they don't get Medicaid, and they can't afford insurance so themselves to get one, and they pay out of pocket, so they are self-payers.
For those who don't have insurance or a health care plan, how often do they come in?
They come only if needed, like when the child is sick, for sick appointment, then they come and they pay out of pocket, and that can be really, really pricey. So it costs a lot of money for them. So they avoid to come when the child is not sick. They don't come for vaccination. They go to health department and give their children free vaccination, but they come when the child is sick to see the doctor, and they pay out of pocket.
Would you advise for people to get a health care plan?
Yes, always, but if they can't afford to have insurance, to pay for insurance themselves, then we give them advice to apply for state insurance. And if they are eligible, then they can get state insurance for their kids.
In 2014, the Centers for Disease Control and Prevention released data on health and healthcare in the United States. Their data found that 4% of all children had no usual source of health care. For children in poverty, it was 6%. The U.S. Department of Health and Human Services released data in 2015 stating that 1/4 of adults ages 19 to 64 living in poverty report fair or poor health, compared with about 8% of those living above the poverty threshold. According to the U.S. Department of Health and Human Services, Americans living in poverty are discouraged from accessing necessary health care due to the cost of co-payments. Because they cannot afford medical care, their health worsens, making them need medical care more and more. In a quote from Catherine Baker, an American economist and a professor of health economics in the Department of Health Policy and Management at the Harvard School of Public Health, insurance is not just supposed to get you access to care. It's supposed to keep you from getting evicted from your apartment because you paid your hospital bill instead of your rent.
So I left my job voluntarily because I took a new job, but my new job health insurance didn't kick in for 45 days after my old job, after I left my old job. So I had to pay COBRA for our family, and my COBRA for 1 month for our family to do medical, dental for you kids, and prescriptions for all 4 of us was $1,800 a month. And I decided to try not to pay it. I thought, well, it's only 45 days, and you have 60 days before you need to sign up for COBRA, and I can't really afford $1,800. So I'm going to, see if I can not pay my COBRA. Well, 10 days ago, I went to the emergency room with like a horrible, agonizing stomach pain, and I ended up having a CAT scan, ultrasound, and something called a HIDA scan, which is when they inject you full of nuclear medicine and see what the heck's happening with your liver and gallbladder. And then I had emergency gallbladder surgery, had that taken out. And I was in the hospital for 3 days and had all those tests and was on IVs. And came out of the hospital, obviously signed up for our COBRA for $1,800 a month plus change. And realized, first of all, that's a lot of money, but if I didn't have the option of COBRA, or I was one of those people living in a situation where I couldn't afford health insurance, our hospital bills after that situation with me would be, I'm guessing between $50,000 and $100,000. And the impact on that on our family is just so catastrophic, I can't even imagine it. And we had the luxury of being able to pay that COBRA bill in the end, but there are people for whom, $1,800 for 1 month of health insurance is just impossible, and so you end up doing like what we did, which is to try to go without it. Let's see if we can go without it.
Anytime you are implementing something big, there's going to be people who are nervous and anxious about, is it going to get done, until it's actually done. But let's just step back for a second and make sure the American people understand what it is that we're doing. The Affordable Care Act, Obamacare, has now been with us for 3 years. It's gone through Supreme Court tests. It's gone through efforts to repeal. A huge chunk of it's already been implemented. And for the 85 to 90% of Americans who already have health insurance, they're already experiencing most of the benefits of the Affordable Care Act. The implementation issues come in for those who don't have health insurance, maybe because they have a pre-existing condition and the only way they can get health insurance is to go out on the individual market, and they're paying 50% or 100% more than those of us who are lucky enough to have group plans. People who are too poor to get health insurance and the employers don't offer them. Maybe they work for a small business and the small business can't afford right now to provide health insurance. So all the implementation issues that are coming up are implementation issues related to that small group of people, 10 to 15% of Americans. Now it's still 30 million Americans, but relatively narrow group who don't have health insurance right now or are on the individual market and are paying exorbitant amounts for coverage that isn't that great. And what we're doing is we're setting up a pool so that they can all pool together and get a better deal from insurance companies. And those who can't afford it, we're going to provide them with some subsidies. In a country as wealthy as ours, nobody should go bankrupt if they get sick, and that we would rather have people getting regular checkups than going to the emergency room because they don't have health care.
Is there anything else that you would like to add on about healthcare and poverty that affects your life or that you know of in the United States?
Well, when you are concerned about whether or not you don't have health insurance, so you don't go to the doctor, obviously you can get more sick, or, for me, I can say that, I knew that I could fill out those corporate papers. I was in horrible pain and I was still like, well, maybe I can wait till February 1st when my health insurance kicks in. And I delayed going to the emergency room. I did finally go in because I thought I was going to die. But it was an unpleasant situation to be in. But I realized I had the benefit of, I could fill out those corporate papers and send them in. And for other people, that would not be possible. And they could get in really catastrophic health situations. A, and B, when you finally do have to go to the emergency room because you have an emergency, you realize that the cost to your family is potentially bankruptcy or homelessness. And, I don't think any family should ever be in that situation.
You used to live in Canada, and the healthcare system up there is different. How does the universal healthcare system in Canada affect people who are living in poverty, in your opinion, compared to down here?
The health insurance is universal in the sense that the health insurance, let's say I'm a low income person, which I was. I got subsidized health care for my kids when I lived in Canada and I was a single mom. Our health insurance was the same as somebody else's health insurance who was maybe getting it through their work, their premiums paid through their work. And so we had same access to all the doctors and hospitals. And we don't have a copay system. So it didn't cost, I didn't have to pay, if my kids needed to go to the doctor, it didn't cost me $30 to take them to the doctor. I could just take them. I didn't have to weigh taking them to the doctor versus buying groceries. I think that the system here is very swift and very effective. I mean, certainly I'm somebody who just had emergency surgery 10 days ago. I was extremely well taken care of when I was in the hospital. It was incredible care. And there's a huge financial concern. So, the system here is great if you can afford to partake in it.
On January 20th, 2017, Donald Trump signed an executive order to begin the process of repealing and replacing the Affordable Care Act. When the Washington Post applied a study that the New England Journal of Medicine had conducted on how many lives the Affordable Care Act saved, they found that the repeal would lead to 43,956 deaths annually. In 2015, those in poverty had a 1.7% decline in uninsured rates, meaning that the Affordable Care Act was doing its job. Without it, many people living in poverty will find themselves losing their insurance and once again facing the impossibly high costs of medical expenses.
State your name.
Isaiah Wilson,
And what would you say your socioeconomic status is?
middle class.
Do you have a healthcare plan?
Yes.
Would you say healthcare plans are worth the cost?
Not all the time, but generally in my experience, yes.
Would you advise others to get a healthcare plan of some sort?
Yes, I would.
How often would you say you visit the doctor, nurse, or etc. to use the healthcare plan you have?
I would say more often than the normal person. I go maybe 5-6 times a year.
So do you think that you get your use out of your healthcare plan?
Yes, very good use.
Alright, thank you.